Okay, so first thing we're gonna do is skin rolling. This is used a lot over like abdominal wall for myofascial release. So we'll just demonstrate there. So you're gonna just grab tissue and you're walking your fingers forward and your thumbs kind of roll through that tissue, and you'll hit little spots where you can feel some tension. Is that uncomfortable? Mm-hmm. Sometimes the patient will notice that, like, oh yeah, that feels tight or a little tender. So you just kind of keep working over that same area. If you need a little coconut oil or massage oil, you can use that too. Sometimes you don't need it, but sometimes you do. You just kind of keep working through that tissue, picking it up, and just rolling the skin under your fingers. This is really effective over C-section scars, but particularly just in the abdominal wall where there's a lot of myofascial tension. Second thing is scar massage. So if we have a C-section scar that's traveling here across the tummy, there are multiple ways to address this, but we want to, one way is to grab that scar and lift. I'm gonna do it this way so you can kind of see it. She doesn't actually have a C-section scar. So we're just lifting the tissue and kind of mobilizing the scar that way. We can also take a couple of fingers and circles along that scar line, or myofascial stretch where we're just pulling the tissue away from each other. Kind of imagine like a saran wrap that's tight. If you let your fingers kind of sink and pull, it will eventually stretch. So think about it that way. Okay. So we're gonna do what's called a ischemic release, which is just applying pressure to a trigger point and holding for 90 seconds. That way you cut off the blood supply to that area. You kind of decrease blood flow to it. It allows those muscle fibers that are locked and kind of trapped with inflammation to release. So we'll find our trigger point. So I'm in her glute med right now. Here's her greater trochanter, glute min, glute med, glute max. So we're gonna be in glute med because there's almost always a good trigger point in there. And you're just feeling the fibers run this way. We always want to palpate perpendicular to those muscle fibers, not parallel. You'll find the trigger point easier that way. So when you find that trigger point, it feels like a little lima bean or something. It feels like a little knot in the muscle. And usually the patient will confirm that also hurts, that's tender. So I'm gonna keep my fingers on that spot, and I'm just gonna hang out here for 60 to 90 seconds. And as you stay there, you may see more referral pattern from that trigger point. So it may travel farther down the leg. It might increase before it starts to decrease, but about 60 to 90 seconds, you should feel a tissue change, and they should also notice that it feels less tender. Okay. Okay. Then we're gonna do strain, counter strain. There's several different ways to do that. That means we're shortening the muscle fiber and applying a little pressure to the trigger point. So I'm gonna demonstrate on IT band because that's a good one to kind of work with. Adductors are good too, those long muscles a lot of times respond well to this. So if I follow along her IT band and just find that spot, is that tender? Right there, just tight and tender. So I'm gonna keep a finger there. So this is kind of a combo, ischemic release, and then we're also gonna shorten. So we're gonna keep a finger on the trigger point, and I'm gonna apply my fingers on either side and bring the muscle fibers together, or the tissue fibers together, and I'm gonna hold this for about 60 to 90 seconds, or until I feel that tissue soften and she feels less discomfort. I am gonna release this. Okay, then another way that we can do strain, counter strain, a good example is pure formis. Roll on your tummy. You covered. Okay, so if we've got some tension or tenderness in pure formis, it runs from your sacrum out to your greater trochanter. So I'm gonna find along that muscle where there's some tenderness, And then if I take her leg, I'm gonna bend the knee, I'm gonna bring you out just a smidge. And then we're gonna put her into some external rotation. So we're putting that muscle in a short position, and I'm supporting her leg, she's totally relaxing, and then we just hang out here. So again, we're putting the muscle in a shortened position and giving it time to reset. And you can apply a pressure, you don't have to. Sometimes patients can do this at home to release that muscle on their own. That's called strain counter strain. The last one is just myofascial release, where you're just creating some stretch across the muscle and fascia, and you want to think about fascial planes when you're doing this. So one good example is across that thoracolumbar fascia, our glute to our lat, that's an oblique sling of fascia. So this is a great place to do some myofascial release. So you take one hand at the top of the glute and you're pulling down in the opposite direction of this oblique sling, and the other hand is going to stretch up towards the lat, towards the shoulder, and then you just want to hold this. I don't hold this quite as long as the ischemic release, maybe 20, 30 seconds. Usually with this one, I can just feel the tissue kind of releasing and giving a little bit, so I get a little more pull from it, and that's when I will stop. And then you'll come the other direction, this glute, towards this lat, and just create that nice fascial pull across that oblique sling. You can apply this anywhere in the body. So you could do this across abdomen in that oblique fashion. You could do this through the abdomen in that deep front line, straight down the center. You can do this across pecs and chest, same idea, but you're just thinking about your fascial planes, and you want to be working into those fascial planes and stretching the direction of that fascial plane.